I'm Marcus Bickford. I'm a radiologist. I'm originally from Watoma, Wisconsin, which is a tiny town in the middle of the state. I think the most important thing for my patients to know is that despite the kind of the classic connotation of a radiologist as just being someone who's in a dark room looking at images, that's really not what we do. We're thinking about the patient more than just the images of the patient, and we're going to take all of the information. We're not just going to use the black and white on the screen. We're going to take the symptoms that the patient has, take the values, take the physical exam, and be able to put all of that together into our report so that our interpretation of the images is not just the images, it's our interpretation of what's going on with this patient. I think the favorite part of radiology is really taking the mysteries and really bringing light to what's going on underneath it. To be able to say, well, this specialist saw this, the surgeon saw this, the family practice doc saw this, these lab values came up. And now we have the imaging, and the imaging says this. And now being able to put it all together and be able to guide the care for this patient, whether it be something that now needs to see a surgeon, or something that can be followed up with the family practice doctor, or something that the patient doesn't need to worry about at all and say, don't worry about this is a very normal finding. I think that's really what I like, is to be able to, like I said, take a mystery or take a situation that's confusing or scary to a patient and be able to say, here's what's going on, this is what needs to happen next. What I really found that I was interested in as I was, in my teenage years was I was an athlete, and so I was always interested in the human body. And you kind of, in some ways, we're studying without even realizing it. How do I get myself faster? How do I get myself stronger? I just sprained my ankle. How do I get better? How to get back onto the field? And you kind of realize that all of these things were, in some ways, learning about medicine in some capacity. And so really when it came to figuring out what I actually wanted to do in life, medicine was kind of a natural progression for me to go into it.